you believe that approximately 85% of people who have baking soda in their homes are completely unaware of its most extraordinary health applications? This common household ingredient, costing mere cents per serving, sits quietly in countless kitchens worldwide, with its true potential largely untapped. Healthcare experts frequently refer to sodium bicarbonate as perhaps the most underutilized medicinal substance available today. Consider this. How many times have you reached for that box of baking soda simply to prepare baked goods or eliminate refrigerator odors, never once considering the wealth of health benefits it might offer? What if you discovered that this unassuming white powder has an extensive history of remarkable applications that could potentially transform your approach to personal wellness? Why does mainstream conversation rarely touch on the genuine capabilities of baking soda? What valuable health opportunities might we all be missing? In this comprehensive guide, we'll explore the extraordinary health advantages of sodium bicarbonate that remain unknown to most people. I'll also outline important safety considerations and identify precisely who should exercise caution when using baking soda therapeutically. This information is absolutely essential for anyone committed to making informed health decisions. Before we delve into the remarkable health benefits of baking soda, if you're new to our wellness community, we extend a warm welcome. Let's grow healthier together. Please consider supporting our channel by liking this video and subscribing to ensure you receive all our upcoming evidence-based health content. Your wellness journey begins right here, and we're genuinely excited to accompany you along the way. We'd also love to hear where you're watching from. Please share your location in the comments section below. We truly value connecting with our global community. Now let's explore the remarkable health applications of this powerful household staple. 1. Natural detoxification support. Baking soda transcends its traditional roles in cooking and cleaning. It's increasingly recognized for its potential to enhance the body's natural detoxification processes. When dissolved in water, sodium bicarbonate creates an alkaline solution capable of neutralizing acidic compounds both internally and externally. Many wellness enthusiasts incorporate baking soda baths into their self-care routines to alleviate skin irritation, reduce persistent itching, and calm inflammatory skin conditions. The therapeutic principle suggests that immersion in a baking soda solution effectively draws impurities from the skin, leaving it noticeably refreshed while promoting overall bodily balance. Although scientific evidence for transdermal detoxification remains limited, countless users report significant improvements in skin comfort and overall well-being after regular use. The internal applications present even more fascinating possibilities. Some health practitioners advocate consuming small amounts of baking soda mixed with water to help alkalize bodily fluids, potentially facilitating more efficient elimination of toxins. Scientific research offers some support for this approach, particularly for individuals with specific health concerns. For instance, a groundbreaking study published in the Journal of the American Society of Nephrology demonstrated that sodium bicarbonate supplementation effectively slowed the progression of chronic kidney disease by reducing harmful acid accumulation in the bloodstream. This research suggests that, under proper medical supervision, baking soda may play a significant role in supporting the body's natural detoxification mechanisms, especially for those requiring assistance with acid management. It's worth noting, however, that the human body maintains sophisticated pH regulation systems, and dramatic alterations through dietary interventions alone remain challenging. Excessive use of baking soda can trigger adverse effects, making moderation essential. When used appropriately, baking soda represents an affordable, gentle approach to supporting your body's inherent detoxification capabilities, potentially enhancing your sense of vitality and rejuvenation. 2. Enhanced oral hygiene and natural teeth whitening. Baking soda has established itself as a cornerstone ingredient in countless toothpaste formulations and home dental remedies for compelling reasons. It delivers remarkable benefits for oral health and natural teeth whitening. If you've experimented with brushing using a small amount of baking soda, you've likely noticed the distinctive smooth, thoroughly cleansed feeling afterward. This sensation results from baking soda functioning as a gentle abrasive agent, effectively eliminating surface discoloration caused by coffee, tea, red wine, and other substances that typically diminish the brightness of your smile. Unlike aggressive chemical whitening treatments that may damage enamel, baking soda's mild abrasive texture effectively polishes teeth without causing significant harm when used as directed. The advantages, however, extend considerably beyond aesthetic improvements to your smile. The alkaline properties of sodium bicarbonate help neutralize acidic compounds in the oral environment. This pH balancing effect is crucial because acidic conditions create an ideal breeding ground for harmful bacteria, often leading to cavities, periodontal disease, and persistent halitosis. By establishing a more balanced pH level in your mouth, baking soda creates a less hospitable environment for these problematic bacteria, promoting healthier gum tissue and significantly fresher breath. Rigorous scientific studies confirm these benefits. Research published in the prestigious Journal of Clinical Dentistry conclusively demonstrated that toothpaste formulations containing baking soda removed significantly more plaque and delivered superior whitening results compared to formulations without this ingredient. Another comprehensive study revealed that baking soda effectively reduced concentrations of harmful oral bacteria, further supporting overall dental wellness. Moderation remains essential, however, as baking soda's abrasive properties could potentially wear down enamel with excessive use. Dental professionals typically recommend limiting application to 2 to 3 times weekly, always using a soft bristled toothbrush and gentle pressure. When implemented correctly, baking soda offers an accessible, budget-friendly approach to achieving a cleaner, brighter, and healthier smile right in the comfort of your home. 3. Effective heartburn relief. Heartburn represents a familiar and often intensely uncomfortable sensation experienced by millions worldwide, particularly following consumption of rich, spicy, or acidic foods. This characteristic burning sensation typically begins in the upper abdominal region and may rise upward into the throat, caused by stomach acid flowing back into the esophagus, a condition medically termed acid reflux. Various factors can increase susceptibility to heartburn, including specific medical conditions such as achalasia or eosinophilic esophagitis, as well as weight fluctuations and pregnancy. While pharmaceutical antacids dominate store shelves, a remarkably effective remedy exists right in your kitchen cabinet. Dissolving approximately 1 teaspoon of baking soda in an 8-ounce glass of water and sipping this solution slowly represents a time-honored approach to rapidly alleviating heartburn discomfort. The scientific mechanism operates on straightforward principles. Sodium bicarbonate's alkaline properties effectively neutralize excess stomach acid, causing the burning sensation, often providing almost instantaneous relief. This remedy has sustained popularity across generations, not merely through anecdotal success, but through scientific validation. The medical establishment widely recognizes sodium bicarbonate as a fast-acting antacid compound. A comprehensive Review published in the respected journal Gastroenterology and Hepatology highlights its demonstrated effectiveness in providing quick relief from occasional heartburn episodes. The accessibility of this solution represents one of its greatest advantages. No special trip to the pharmacy or expensive treatments required. Simply combining baking soda with water creates an effective remedy that works within minutes, allowing you to return to your daily activities with renewed comfort. This practical, evidence-based approach explains why baking soda remains an essential component of many household medicine cabinets for those seeking reliable, rapid relief from occasional heartburn symptoms. 4. Natural antifungal properties. Fungal infections represent common, persistent nuisances that frequently manifest as itchy, reddened, or flaking skin patches, particularly in warm, moisture-prone areas like feet, groin, and skin folds. Conditions such as athlete's foot, ringworm, jock itch, and similar fungal issues thrive in damp environments where fungi can multiply rapidly. While commercial antifungal preparations abound in pharmacies, a remarkably effective and natural alternative awaits in your kitchen pantry. Baking soda's effectiveness against fungal organisms stems from its unique ability to disrupt the environmental conditions these organisms require for proliferation. When applied topically, sodium bicarbonate creates an alkaline microenvironment that compromises fungal cell wall integrity, significantly hampering their ability to survive and reproduce. This approach represents not merely folklore passed through generations, but has garnered scientific validation through rigorous research. A groundbreaking study published in the specialized journal Mycopathologia demonstrated that a solution containing just 10 grams of baking soda per liter effectively inhibited the growth of an impressive 80% of tested fungal strains. These compelling results highlight baking soda's significant potential as a natural, non-toxic antifungal agent for addressing common fungal infections. Application methods remain straightforward and accessible. A simple paste created by combining baking soda with sufficient water can be applied directly to affected skin areas. Alternatively, adding several tablespoons to a foot bath provides an effective treatment for persistent athlete's foot. Many individuals report substantial improvement in irritation and discomfort after just a few consecutive applications. The gentle, non-toxic nature of baking soda makes it particularly appealing for those seeking to avoid harsh chemical agents or those with sensitive skin. For anyone struggling with recurrent fungal infections, this affordable, readily available remedy offers a promising natural alternative that may help restore both physical comfort and confidence in daily activities. 5. Urinary tract infection relief. Urinary tract infections, UTIs, represent a widespread and frequently painful health concern, particularly affecting women, with symptoms including intense burning during urination, frequent urges to urinate, and generalized discomfort in the lower abdominal region. While antibiotics remain the gold standard treatment, many individuals seek complementary approaches to alleviate symptoms and support recovery. Baking soda has emerged as one such supportive remedy with scientific rationale behind its application. The therapeutic principle underlying baking soda's effectiveness for UTI symptoms centers on its capacity to neutralize acidic compounds. When consumed in carefully measured amounts mixed with water, sodium bicarbonate helps reduce the acidity of urine. This pH modification potentially creates a less favorable environment for the bacteria responsible for UTIs, potentially inhibiting their proliferation and enhancing the body's natural ability to eliminate the infection. Additionally, reduced urine acidity often diminishes the burning sensation that makes UTIs so extraordinarily uncomfortable. Scientific literature provides preliminary support for this approach. In a clinical investigation published in the Japanese Journal of Urology, 33 women experiencing recurrent UTIs received sodium bicarbonate as a component of their treatment protocol. Following a 4-week intervention period, a significant proportion of participants reported substantial improvement in symptoms, including reduced pain and discomfort during urination, improved urinary flow, and decreased frequency. Although these results appear promising, it's critical to emphasize that baking soda should complement rather than replace conventional medical intervention for UTIs, particularly in severe or persistent cases. For those seeking supplementary relief alongside prescribed therapies, baking soda offers a gentle, cost-effective approach to alleviating discomfort. It's essential to note that persistent or severe UTI symptoms require prompt evaluation by healthcare professionals, as untreated infections can potentially spread to the kidneys and cause serious complications. When used judiciously and under appropriate guidance, baking soda can serve as a valuable addition to your toolkit for managing urinary health and enhancing comfort during recovery. 6. Effective canker sore treatment. Anyone who has experienced the sharp, persistent discomfort of a canker sore understands how these small ulcerations can significantly impact daily activities like eating, drinking, and even speaking. Fortunately, baking soda offers a remarkably effective, affordable remedy for these troublesome mouth lesions. Canker sores, medically termed aphthous ulcers, commonly develop due to various triggers, including emotional stress, minor oral injuries, certain food sensitivities, and nutrient deficiencies. They can transform simple activities into painful challenges that persist for days or even weeks without proper intervention. Sodium bicarbonate demonstrates remarkable effectiveness against canker sores through its unique ability to neutralize acids in the oral cavity, establishing a more balanced pH environment. This pH optimization proves crucial because acidic conditions typically delay healing processes and intensify irritation of sensitive oral tissues. By rinsing with a solution, combining approximately half a teaspoon of baking soda in 8 ounces of warm water, you can effectively reduce inflammation, soothe discomfort, and potentially accelerate healing times significantly. The scientific community has validated these therapeutic effects. A comprehensive clinical study published in the Journal of the American Dental Association determined that sodium bicarbonate oral rinses substantially reduced pain intensity and promoted accelerated healing in patients suffering from recurrent aphthous stomatitis. Researchers concluded that baking soda's mild antiseptic and anti-inflammatory properties effectively maintained cleanliness of the ulcerated area while reducing bacterial proliferation, factors essential for optimal recovery. Unlike certain commercial oral treatments that may contain alcohol or harsh chemicals, baking soda provides a gentle approach unlikely to cause additional irritation to already sensitive tissues. This characteristic makes it particularly suitable for frequent use until symptoms resolve. The next time you notice the telltale signs of a developing canker sore, consider implementing a simple baking soda rinse several times daily. This natural, scientifically supported approach offers an effective pathway to finding relief and supporting your oral health using a simple ingredient from your kitchen. 7. Athletic performance enhancement. Did you realize that a common kitchen ingredient could potentially provide a significant advantage during your workout sessions? Remarkably, baking soda transcends its conventional culinary and cleaning applications. It's actively utilized by competitive athletes as a performance-enhancing supplement to boost endurance and combat muscle fatigue during intensive training. The physiological mechanism operates on principles directly related to acid-base balance. During high-intensity exercise, muscle tissues produce lactic acid, causing a decrease in localized pH levels that manifests as the familiar burning sensation experienced during strenuous activity. This increasing acidity represents a major contributor to muscle fatigue, often forcing premature termination of exercise before reaching true physical limits. Sodium bicarbonate functions as a natural buffering compound in this context. When consumed in appropriate amounts before exercise, it helps neutralize excess acid accumulation in muscle tissues, potentially allowing athletes to maintain higher intensity levels for extended periods while delaying the onset of performance-limiting fatigue. This application extends beyond fitness theory into evidence-based practice. A comprehensive meta-analysis published in the Journal of Strength and Conditioning Research evaluated multiple controlled studies and concluded that sodium bicarbonate supplementation significantly enhanced performance metrics in high-intensity, short-duration athletic activities, including sprinting, swimming, and cycling. Researchers determined that athletes utilizing baking soda supplementation experienced delayed fatigue onset and maintained peak performance capabilities for noticeably longer durations. Typical protocols involve mixing approximately 1 teaspoon of baking soda with sufficient water, consumed 60-90 minutes before intense training sessions. However, proper dosing requires careful attention, as excessive amounts may trigger gastrointestinal discomfort, including bloating, cramping, or nausea that could counteract potential performance benefits. For athletes seeking natural, evidence-based methods to optimize training effectiveness and competition performance, baking soda represents a cost-effective option worth consideration. As with any supplementation strategy, consultation with qualified healthcare professionals remains advisable, particularly for individuals with underlying health conditions or those taking medications. Experiment with this approach during your next challenging workout. You might be surprised by the noticeable improvement in your stamina and overall exercise capacity. 8. Kidney function support. Consider the potential benefits if something as accessible and economical as baking soda could help safeguard kidney function, particularly for individuals managing chronic kidney disease, CKD. For many CKD patients, the kidneys struggle to efficiently remove acid compounds from the bloodstream, resulting in a condition called metabolic acidosis. This acid accumulation can accelerate kidney damage progression and negatively impact overall health status. Baking soda, scientifically known as sodium bicarbonate, functions as a natural alkalizing agent, effectively neutralizing excess acid in the bloodstream. By reducing blood acidity levels, sodium bicarbonate may reduce the functional burden on compromised kidneys and potentially slow disease progression. This approach represents more than merely a home remedy. It's supported by substantial scientific evidence. A landmark clinical investigation published in the Journal of the American Society of Nephrology followed patients diagnosed with advanced CKD and concurrent metabolic acidosis over an extended period. Researchers discovered that participants receiving daily sodium bicarbonate supplementation experienced significantly slower decline in renal function compared to control subjects. Remarkably, the intervention group demonstrated reduced risk of developing end-stage renal disease, requiring dialysis intervention. The study additionally documented improvements in blood bicarbonate measurements, a critical indicator of acid base homeostasis. It's crucial to emphasize that sodium bicarbonate doesn't represent a curative approach and should never be implemented without proper medical supervision. Excessive consumption can potentially trigger complications, including hypertension, fluid retention, and electrolyte imbalances, particularly in individuals with cardiovascular or renal conditions. If you or someone you care about has been diagnosed with CKD, consult qualified healthcare providers before considering baking soda as a therapeutic adjunct. When implemented appropriately under professional guidance, this humble kitchen ingredient might potentially play a meaningful role in supporting kidney health and enhancing quality of life for those managing chronic kidney conditions. 9. Arthritis. Pain management. Imagine discovering meaningful relief from arthritis discomfort through something as simple and accessible as baking soda. An unassuming ingredient likely already present in your kitchen cabinet. Arthritis, particularly the rheumatoid variant, represents a condition characterized by persistent inflammation, leading to joint pain, swelling, and restricted mobility that can significantly compromise quality of life. While conventional management typically involves pharmaceutical interventions and physical rehabilitation, recent scientific discoveries suggest that sodium bicarbonate might offer a complementary, natural approach to managing inflammatory symptoms. The scientific rationale behind this application is both fascinating and promising. A groundbreaking 2018 study published in the prestigious Journal of Immunology revealed that regular consumption of a baking soda solution could potentially influence immunological responses in the body. Researchers discovered that sodium bicarbonate appears to activate anti-inflammatory pathways while simultaneously moderating the autoimmune activity that drives conditions like rheumatoid arthritis. Both animal models and human participants in the investigation demonstrated measurable reductions in inflammatory markers, with the balance of immune cells shifting toward a less inflammatory profile. These findings suggest that baking soda may effectively modulate immune system activity, potentially reducing the joint inflammation and discomfort that characterize arthritis conditions. For individuals living with arthritis symptoms, this research opens intriguing possibilities for symptom management. Incorporating a moderate baking soda regimen into daily routines could potentially help regulate inflammatory responses and improve joint comfort without the side effects associated with some conventional medications. While additional research remains necessary to fully characterize long-term benefits and optimal protocols, the possibility that such a common household product could contribute to arthritis symptom management represents an empowering development. It serves as a poignant reminder that sometimes the most effective supportive measures may be hiding in plain sight, waiting to be discovered and implemented. As with any complementary approach, individuals should consult healthcare providers before beginning regular baking soda consumption, particularly those with pre-existing medical conditions or those taking medications that might interact with sodium bicarbonate. 10. Gout symptom relief. Gout represents a particularly painful form of inflammatory arthritis, often presenting with sudden, intense episodes of pain, redness, warmth and swelling, frequently affecting the metatarsophalangeal joint of the big toe, though other joints may become involved. The underlying cause involves elevated uric acid levels in the bloodstream, leading to the formation of sharp, needle-like crystals within joint spaces that trigger severe inflammatory responses. Management typically focuses on strategies to reduce circulating uric acid and alleviate the resulting discomfort. Baking soda or sodium bicarbonate emerges as a surprisingly effective home remedy in this context. Its alkaline properties allow it to neutralize excess uric acid in the circulation, potentially reducing the formation of painful crystalline deposits in joint tissues. By helping restore more balanced pH levels, regular baking soda consumption may reduce both the frequency and severity of acute gout attacks. Scientific literature provides support for this therapeutic application. Research published in the journal Arthritis and Rheumatism demonstrated that alkalizing agents, including sodium bicarbonate, effectively dissolve uric acid crystal formations and enhance their elimination through urinary excretion, potentially offering significant relief during acute gout episodes. Many individuals report substantial symptomatic improvement when consuming a solution containing half a teaspoon of baking soda dissolved in 8 ounces of water during flare-up periods. Beyond pain management, this approach may also help reduce inflammatory responses in affected joints, improving mobility and functionality during recovery periods. It's essential to emphasize that while baking soda represents a valuable addition to comprehensive gout management strategies, it should always be implemented with guidance from qualified healthcare professionals. This ensures maximum therapeutic benefit while minimizing potential complications, particularly for individuals with coexisting health conditions. For those seeking natural, evidence-based approaches to managing gout symptoms, baking soda offers an accessible, economical option that might significantly improve comfort and quality of life during challenging flare-up periods. 11. Cold and flu symptom relief. When seasonal cold and flu viruses strike, the resulting constellation of symptoms, including throat irritation, nasal congestion, and persistent mucus production, can significantly disrupt daily activities and impact overall comfort. Remarkably, baking soda, an affordable household staple, may serve as a powerful ally in managing these common respiratory complaints thanks to its natural alkaline properties and gentle antimicrobial effects. Sodium bicarbonate demonstrates particular effectiveness in breaking down stubborn mucus secretions, potentially enhancing clearance of nasal passages and improving breathing capacity. This property proves especially beneficial when dealing with persistent congestion that resists conventional interventions. One of the most effective applications involves using baking soda as a therapeutic gargle. Combining half a teaspoon of sodium bicarbonate with 8 ounces of warm water creates a soothing solution that can help alleviate throat discomfort and irritation. Regular gargling not only provides symptomatic relief, but may also reduce microbial load in the oral cavity and throat, creating an environment less conducive to viral replication. Scientific validation supports these applications. Clinical research, published in the Journal of the American Dental Association, demonstrated that regular gargling with a baking soda solution significantly reduced throat irritation and microbial presence, potentially supporting faster recovery from upper respiratory infections through multiple mechanisms. Baking soda can additionally enhance traditional saline nasal irrigation solutions, improving their effectiveness in breaking down mucus secretions and neutralizing acidic compounds that may contribute to tissue irritation. This complementary approach supports the body's natural defense mechanisms and may accelerate recovery timelines. For individuals experiencing cold or flu symptoms, baking soda represents a gentle, evidence-based intervention that may significantly impact symptomatic burden and recovery time. This accessible home remedy demonstrates that sometimes the most effective solutions for common ailments require nothing more than simple ingredients already present in most kitchens. 12. Potential cancer treatment enhancement. The concept that baking soda might play a complementary role in oncological treatment protocols may initially seem surprising, yet this possibility has generated significant interest within the scientific research community. Cancer cells characteristically thrive in acidic microenvironments, which not only supports their proliferation, but may also contribute to therapeutic resistance. Sodium bicarbonate, with its natural alkalizing properties, has been investigated for its potential to modify the pH surrounding tumor cells, creating an environment less conducive to cancer cell growth and metastatic spread. One particularly noteworthy investigation, published in 2009 in the prestigious journal Cancer Research, documented compelling findings. Researchers administered sodium bicarbonate to mouse models with metastatic breast cancer and observed significant reductions in tumor acidity levels. This pH normalization appeared to slow cancer progression substantially and enhanced tumor cell susceptibility to conventional chemotherapeutic agents. These findings suggest that by neutralizing the acidic microenvironment surrounding malignant cells, baking soda might potentially augment the effectiveness of standard cancer treatments through multiple mechanisms. The scientific community continues exploring whether alkalizing agents like sodium bicarbonate could be safely incorporated into integrative oncology protocols alongside conventional therapies to improve patient outcomes across various cancer types. Current research examines optimal administration methods, dosing protocols, and potential synergistic effects with established treatments. It remains essential to emphasize that this research area, while promising, remains in preliminary stages. While results from animal models appear encouraging, additional well-designed clinical trials involving human subjects are necessary before sodium bicarbonate can be recommended as a standard component of cancer treatment protocols. At present, baking soda should not be viewed as an independent cancer therapy, but rather as a potential adjunctive measure that may eventually complement existing evidence-based treatments. Individuals undergoing active cancer treatment should always consult with their oncology team before considering any supplementary interventions, including baking soda, to ensure appropriate integration with their personalized treatment plan. 13. Natural deodorant alternative. For those seeking a simple, natural alternative to conventional deodorant products, baking soda offers a remarkably effective solution derived straight from your pantry. Unlike many commercial deodorant formulations that depend on synthetic fragrances, antimicrobial agents, and aluminum compounds, sodium bicarbonate provides a clean, minimalist approach to personal freshness without potentially concerning chemical additives. The effectiveness of baking soda as a natural deodorant stems from its dual mechanism of action. It neutralizes acidic compounds in perspiration that contribute to body odor development while simultaneously absorbing excess moisture. This creates an environment where odor-causing bacteria struggle to proliferate, helping maintain freshness throughout demanding days without relying on synthetic ingredients. Scientific evidence supports the efficacy of this approach. A controlled study published in the Journal of Cosmetic Dermatology demonstrated that topical sodium bicarbonate application significantly reduced axillary, underarm odor compared to placebo interventions. Researchers attributed this benefit to baking soda's alkaline properties, which effectively counteract acidic compounds produced during bacterial metabolism of sweat components, substantially reducing malodorous compounds. The absence of parabens, aluminum compounds, synthetic fragrances, and other potentially problematic ingredients makes baking soda particularly appropriate for individuals with sensitive skin, or those preferring to minimize exposure to synthetic chemicals in personal care products. Implementation remains straightforward. Simply apply a small amount of baking soda to clean, dry underarms, either as a powder or combined with coconut oil for enhanced moisture. Many users report effective odor protection throughout the day, even during physical activity or in warm weather conditions. While individual skin sensitivity varies and patch testing is advisable, baking soda represents a popular choice for those seeking natural, environmentally conscious approaches to personal hygiene. For individuals prepared to transition away from conventional deodorant products, baking soda offers an accessible, evidence-based alternative that promotes confidence and freshness through natural means. While baking soda offers an impressive array of potential health benefits, it's crucial to recognize that it may not be appropriate for everyone. Certain populations should exercise particular caution, especially when considering regular use or higher dosages for either internal or external applications. Individuals with kidney dysfunction require special consideration due to baking soda's sodium content. Those with compromised renal function may experience difficulty eliminating excess sodium, potentially leading to fluid retention, electrolyte imbalances, and other serious complications that could further compromise kidney health. People managing hypertension should likewise approach baking soda with caution. The sodium component can potentially contribute to elevated blood pressure measurements, presenting additional risk factors for those already navigating high blood pressure challenges. Similarly, individuals with gastrointestinal conditions, including gastritis, peptic ulcers, or gastroesophageal reflux disease, should consult healthcare providers before using baking soda therapeutically. While it may provide temporary relief for some acid-related symptoms, it can potentially disrupt natural stomach acidity and exacerbate certain digestive disorders through multiple mechanisms. Pregnant and breastfeeding women represent another group requiring particular consideration. Excessive sodium bicarbonate consumption could potentially disturb the body's delicate electrolyte balance, with potential implications for both maternal and fetal infant well-being during these physiologically sensitive periods. Those with known allergies or sensitivities might experience adverse skin reactions or digestive discomfort when using baking soda externally or internally. Preliminary patch testing with diluted solutions is advisable before more extensive application to identify potential reactivity. Individuals with respiratory conditions should avoid inhalation of baking soda powder, as airborne particles may irritate sensitive airways and potentially trigger or worsen breathing difficulties in susceptible individuals. In all situations, moderation and appropriate guidance remain paramount. If you identify with any of these risks, categories, or have underlying health concerns, consultation with qualified healthcare professionals before incorporating baking soda into your wellness routine represents the most prudent approach to ensure safety and appropriate application. As we've explored throughout this comprehensive guide, baking soda represents far more than just a basic kitchen ingredient. It emerges as a versatile, evidence-based wellness tool capable of supporting health across multiple dimensions. From alleviating throat discomfort during respiratory infections to managing gout symptoms and even potentially enhancing athletic performance, its applications are validated by both traditional wisdom and contemporary scientific investigation. However, responsible use requires acknowledging the importance of appropriate application methods, reasonable dosing, and recognition of individual contraindications. Consulting healthcare professionals before implementing therapeutic baking soda regimens, particularly for those with pre-existing health conditions, remains essential for maximizing benefits while minimizing potential risks. Have you previously explored any of these baking soda applications in your personal wellness journey? Do you have additional insights or experiences to contribute to our community knowledge base? We warmly invite you to share your experiences, questions, and observations in the comments section below. Our community thrives through this exchange of practical wisdom and mutual support. If you found value in this information, please consider supporting our educational mission by liking this video, subscribing to our channel, and sharing this resource with friends and family members who might benefit from these evidence-based wellness strategies. Together, we can empower more people to make informed health decisions using accessible, natural approaches. Thank you sincerely for joining us today in exploring the remarkable potential of this humble yet powerful household staple. Your health journey matters to us, and we look forward to continuing our shared exploration of evidence-based natural wellness approaches.